Okay, good afternoon, everyone, and thank you for joining us for our third Reach Out and Read Wisconsin webinar here in Wisconsin, or at Reach Out and Read Wisconsin in 2020. So thank you all for joining. We're excited to have Dr. Burton talk a little bit about how she's seen the effects of Reach Out and Read in some of our clinics right here in Wisconsin. Before we get started, I just want to go through a few housekeeping items. So just so everyone is aware, all participants are muted upon entry. If you do have any questions throughout Dr. Burton's presentation, please feel free to ask them in the chat box below. So the chat box is down in the tool screen at the bottom or top of your page, and it looks like a little chat bubble. I will be reading aloud all of the questions at the end of the presentation within the last 5 minutes. So please feel free to ask throughout or right at the end, and I will read them for Dr. Burton to answer. This webinar is being recorded, and we will be posting to our Reach Out and Read Wisconsin website. So if you want to look back on it, or anyone else who wasn't able to join today, feel free to send on to them. And you will be receiving a survey after the webinar just to get a little more information as we continue these webinar series. With that, I'm going to turn our introduction today over to Reach Out and Read Wisconsin Medical Director, Dr. Dipesh Nosaria, and he will talk a little bit about this research with Dr. Burton.
Great, thank you very much, Amber. I'm staying off the video because I'm on a somewhat dodgy Wi-Fi connection here and don't want to presume too much. It is really a delight to be able to introduce Dr. Burton. She made the mistake of somehow running into me in medical school and being interested in doing some work together. And I said to her, you know, we know a lot about Reach Out and Read, and we know a lot about Reach Out and Read's effect for children and families, the positive benefits. But, you know, I think there's actually something there about Reach Out and Read's effect on clinics and clinicians, and it would be fantastic if you could help us look at that. And she did a really amazing job teaching herself actually qualitative methods to be able to do this work, which some of you on this call actually may have been participants in, and if not, it was your colleagues throughout the state. This is now a study that's been, she'll tell you, published and is actually on the Reach Out and Read website as an example of our broad evidence base for what is possible. She did her medical training, of course, right here in Madison at the University of Wisconsin School of Medicine and Public Health, and she is a pediatric resident now at the other W, the Seattle Children's in Washington State. And I had the deep pleasure of seeing her earlier this year when I was in town for a conference in early February, right before everything went nuts in the world. It feels like it. And sharing with you the outcomes there. Take it away.
Awesome, thank you so much. I'm just gonna share my slides here with everyone. If you can't see them, let me know, but they should be coming through right now. All right, awesome. So like Dr. Nosaria said, this is a research project that we worked on actually a couple years ago. We started doing this research in 2015 and then kind of finished doing the data analysis and then ended up getting it published last year. And I'm super excited to share it with everyone. I know we had a lot of really awesome participation throughout the state, and so it's exciting to share our findings. And we overall have a lot of really positive findings to share. So exciting news from this front. So just a little more background about kind of why we did this study and what our thought process was behind it. Like you guys are familiar with, Reach Out and Read has had a lot of research kind of backing it up over the past couple of years, especially relating to kind of the effect on early childhood literacy. And so there's been a lot of previous studies that have looked at the Reach Out and Read program and have shown that it's increased the amount of time spent at home reading as a family. It's been shown to increase the amount of books that are in the home, And then it's also been associated with higher language scores for children and higher vocabulary scores for kids who are participating, which is all excellent and really great backing for why we're doing this incredible program. But there really had not been a lot of research on how this program affects the clinic itself and kind of changes that clinics can expect to see when they're initiating the Reach Out and Read program. And we thought that, given that a lot of new programs are thinking about implementing Reach Out and Read, it's really important to know what changes should they expect, and are there negative things they should be expecting? Are there positive things they should be expecting to see? And so really that was our big goal with this study, was determining how clinic values and clinic knowledge related to early childhood literacy is affected by implementing the Reach Out and Read program. And then looking at how providers and staff feel that the program has actually influenced the culture and influenced their clinic itself. And then also looking at any barriers to implementation or changes that were unanticipated in clinics, just to help additional clinics prepare when they're doing implementation. And so the way that we did this was we designed a qualitative study, and our methods consisted mainly of phone interviews with kind of what we consider key informants, who were the medical director and the clinic coordinator at different sites with Reach Out and Read. And we ended up designing our study in such a way, so we had the study group, which was Wisconsin clinics that had Reach Out and Read already in effect for more than a year. And then the control group was Wisconsin clinics that currently did not have Reach Out and Read, but were in the process of applying for the program. And the reason that we chose the control group as clinics that were applying for Reach Out and Read is because we thought that there might be some fundamental difference between clinics that were actually interested in applying for Reach Out and Read versus those that were not, just in terms of their motivation to incorporate early childhood literacy and things like that into their clinic culture. And we wanted to kind of decrease that confounding variable in our research. And the reason that we chose the study group as clinics that had Reach Out and Read for more than a year was just to get a better sense of changes that may not be immediate after starting the program. We wanted to get kind of a longer term view of what had happened in the clinics after starting Reach Out and Read. We tried to get a mix of clinics that were kind of distributed throughout Wisconsin. Obviously, there's a lot of geographic diversity in the state. And so we got a mix of urban and rural clinics. And also we're able to get a mix of kind of academic clinics, community clinics, federally qualified health centers, and kind of larger clinic systems as well. And the questions that we asked during these interviews really focused on overall work environment in the clinic, interactions among coworkers, what the clinics were currently doing for their early childhood literacy promotion, and then what they for the clinics that were applying for Reach Out and Read, what they perceived as the barriers of Reach Out and Read, or for the clinics that did have Reach Out and Read, what were the actual barriers to starting this program. And then for the study clinics, one of the questions we asked was just what changes they had seen in their clinic after starting Reach Out and Read. And so we ended up reaching out to 26 study clinics and had 10 of them respond and participate in a phone interview. And then of the 25 control clinics that we reached out to, we ended up interviewing 7, and most of that was based on scheduling constraints. Overall, I would say the results for the study were very positive and really kind of shone a light on a lot of positive effects of the Reach Out and Read program. One of the questions that we asked was, how important does the clinic consider early childhood literacy? And I think, the common theme was that every single clinic we talked to, with or without Reach Out and Read, felt like early childhood literacy was very important to a child's development and is definitely something that pediatricians should be focusing on in well child checks. So I think that was really positive. The interesting thing was that when we asked the clinics what they think a clinician's role is in promoting this early childhood literacy, there were some responses that were similar between both groups, but the study group, or the group with Reach Out and Read, definitely identified additional responsibilities of the clinician compared to the control group. So both of the groups mentioned that the role of the clinician is to get books into the home, to give families anticipatory guidance about literacy, to really stress the importance of reading to parents, and then also to give parents age-appropriate suggestions for reading as the kids are kind of getting older. But there was a lot of additional answers that I think were very valid answers that were brought up by the study group. So the study group providers also mentioned the benefits of encouraging bedtime routines for sleep hygiene, promoting family bonding through reading, helping connect parents with resources in the community like libraries and schools, using reading as a way to minimize screen time for kids, and then also helping parents who themselves have low levels of literacy and helping them both learn how to to work with their kids when they're learning to read, and also ways to connect them with additional resources in the community. When we asked the control clinics what they were currently doing for early childhood literacy promotion in the clinic, unfortunately, almost all of them said that they don't have any formal literacy promotion right now, and they're just doing inconsistent verbal discussion during clinics, during clinic visits, but they're not consistently remembering to do it. And it's definitely varying between providers. I think one question that was really important was asking what are the perceived disadvantages of Reach Out and Read. And so the clinics that are applying for Reach Out and Read did actually have a few concerns about the program. I would say the biggest concerns that they mentioned during the study were time commitment for providers, concerns about funding and who is going to be paying for the books, concerns about actually implementing the program and barriers to getting the program started, extra work for staff and providers, and remembering to give the book. Interestingly, when we asked the study clinics that have Reach Out and Read what they saw as the barriers, they almost universally either said there was no disadvantage or they mentioned funding. The only other disadvantage that was brought up at all by the Reach Out and Read clinics was one clinic said that training for residents in particular was a challenge just with their time constraints, but no other clinics mentioned that timing or time commitments for providers had actually been a barrier to the program, which I think is really important. We also asked the study clinics directly what changes they had seen in their clinics after starting Reach Out and Read. And so this list here is kind of some of the common themes that we saw throughout many of the clinics. So a lot of the clinics reported overall that they had been taking a larger approach to literacy, not just in the well child checks, but really in the whole clinic. And so they were incorporating more things like literacy-rich waiting rooms, lending libraries, talking with families about literacy more, even when they were outside of the age window of Reach Out and Read. They also reported consistently spending more time on literacy and visits, giving out more books. Multiple providers noted that using Reach Out and Read really was helping them with their developmental assessment and was giving them a lot of information that they hadn't previously been picking up on about kids, kids with developmental delays or motor delays during the well child checks. Clinics noted that even if they had been previously giving out some type of books, they were now giving out much more developmentally and culturally appropriate books, which they noted as a huge benefit. And then in terms of looking at how the clinic had actually, or how the clinic itself had actually changed after implementing the Reach Out and Read program, overall, it was noted that this program boosted clinic morale. Multiple clinics noted that it was an exciting thing for providers and staff, and they looked forward to coming to work to do it. It improved provider satisfaction, and it improved patient-clinician relationships because families felt like this was really a way that the clinician was showing they cared about the kid's long-term future. And then finally, we asked, had there been any negative changes that you've seen since implementing this program? And of all of the clinics we studied, none of them had seen any negative changes since they started the Reach Out and Read program, which is excellent. And I wanted to just share a few quotes that we had been shared during our research because I think they really kind of summarize some of these themes. One provider said, I think it's more than just talking about it. I think it's actually showing them and having them see a book. That really fields it. That makes it much more meaningful to families. And this theme had been brought up a couple times too, as having the book as something that the family can physically take home with them is really a good reminder of the whole discussion about literacy and will often spark them to, take more time at night and when they're at home to kind of think about this and figure out ways to incorporate it into their daily routines. One provider said, I'm probably happier with my job and my work since implementation of the Reach Out and Read program at my clinic. Another individual said, Reach Out and Read has given some people an opportunity to showcase some additional skills, giving them more responsibility to do some things and giving them some ownership. And that was in reference to various staff members at the clinic who had taken a really active role in the program. And then finally, this was a pretty common theme. Someone said, everyone's having a ton of fun with this. The providers are loving it, the patients are loving it, and the staff is loving it. So overall, I think, this is a small study. We really did not have the bandwidth to interview throughout the entire state, but overall, we saw a lot of really positive results. I think biggest limitations other than size for this study were that the control group in the study may not be representative of all clinics throughout the state. We purposely chose a control group that already had shown some motivation to apply for Reach Out and Read, but this may not necessarily represent the ideas of all clinics, especially, clinics that currently are not applying for any type of early literacy promotion. And then the other component of this is that, of course, we were talking to the medical director and the clinic coordinator for Reach Out and Read at these sites. And so they likely are program advocates, and it's hard to get a feel of whether these are the opinions of every single person at the clinic. But overall, I think very positive results. And this, I think, continues to add to the large amount of growing research that is really supportive of Reach Out and Read. Biggest common themes that we saw was that the Reach Out and Read program does improve employee satisfaction, improves morale at the clinics, and was found to positively impact patient-clinician relationships. And really the only consistent barrier that was noted was funding. There was a lot of concern by the clinics that were applying about time constraints, especially for providers and well-child checks, but none of the providers that were using Reach Out and Read noted this to be an issue at all. And so I think big picture takeaways from this study is that, you know, clinics who can be more reassured when they're in application for this program, because we really did not see any negative side effects and only saw positive changes at the clinics. And then I think the other piece of this is that when clinic systems are looking at ways to, you know, improve early childhood literacy and also improve morale and increase employee retention at clinics, this is a really good thing to consider. It's, you know, it's kind of a win-win. It helps the children, helps the families, and also improves staff satisfaction with their job, which, especially with all of the stressful things going on, is a major advantage as well. I wanted to just very briefly switch gears and mention one other kind of Reach Out and Read related project that we've been working on here. So at Seattle Children's Hospital, we've, for the past couple of years, have been working on an inpatient Reach Out and Read project. And I just wanted to briefly mention this in case it's something that other people might be interested in as well. And so basically, they started this program a couple of years ago at Seattle Children's Hospital, and they're doing a pretty similar format to outpatient well-child checks, but essentially we're giving away books and doing the Reach Out and Read program for kids who are admitted to the hospital between age 6 months and 5 years. And it's any kids who are on the general medicine service or the hem-onc service, and we've kind of been expanding it over the past year. But basically, we'll have the intern or the medical student pick out a book and then go into the room when it's a good time and there's not a lot of procedures or anything going down and there's kind of some downtime. And then similar to a well-child check, they'll give it to the family. They'll kind of have a discussion about development and model interactive reading with the family. And we've found that it's a really great role for medical students in the hospital, because it's an awesome chance to practice developmental assessment and to practice promoting first relationship skills and kind of that relationship building with the family. And we've got really positive results from the families too. They've felt like this really has created a bond with the providers, and also has kind of shown more that, you know, the providers really do care about the long-term impacts of health on this kid and not just getting them home from the hospitalization. We have had a little bit of a setback this year, just in terms of like kind of stocking and implementation and things. A lot of our book stocking is performed by volunteers, and with COVID, the hospital had kind of prevented all volunteers from coming in to try to minimize the number of people in the hospital. And so we had to figure out some various ways of stocking and kind of recording the results and tracking things. But now we're back on track, and so we're working on expanding again. So overall, I think it's been really fun. I think it's been a really fun experience for all the residents too, as just an extra way to connect with the families, more than just, you know, based on the typical things that we would talk with them about during the hospitalization. So if anyone has any additional questions or thoughts on that, I'm more than happy to talk about them. That is all I wanted to chat about. Dr. Nassari, I don't know if you have any other thoughts or questions, or if we have comments or questions from the group.
Yeah, thank you. Please, for participants, if you have questions, please put them in the chat box. We'd love to be able to address them. I wanted to just make a framing comment and then throw a brief question in here as well. First of all, this is actually the first time anyone nationally has looked at the effect of the Reach Out and Read intervention on the clinic environment and the clinicians themselves. So this as small a study as this was actually uncharted territory, and some of it obviously was sort of a no duh, right? Like, we're talking to people who've implemented Reach Out and Read, then who's going to say to you that, you know, like, early literacy is important, right? There's a social desirability bias there. But we were really happy to see some of the nuances that came out, that how it's not just about saying reading's important, go give out books, that the training actually offered some specificity and some particular things to say. And also from a cost of implementation, I don't mean just financially, but from a trouble perspective, the clinics that had already done it did not seem to have concerns about implementation, except in terms of ongoing financing, whereas the ones that hadn't done it yet were still a little unsure. So it was reassuring to show that the process of Reach Out and Read and the technical support and the qualities assurance all makes a difference. Heather, did you find, what was it like doing qualitative studies? I think many of us are used to survey work or things of that nature. In terms of doing these sorts of interviews, what was the experience like?
Yeah, I think it was a different strategy going into it. Like the previous research that I had done also was kind of more numerical data and analysis. And so it was kind of a big mind shift. But once I like started getting into it, I actually thought it was really enjoyable. And I think it was like, there was kind of more satisfaction throughout the process of doing the research because I got to just talk to so many awesome clinicians working throughout the state and hear all of their opinions on things. And so the interviews themselves, I think, were really beneficial even when I was doing them, and just like really interesting data to collect. And then the kind of the coding and the analysis process was definitely a learning curve, but was something that I think now that I've done it once, I think it was something that would definitely, continue to work on. They basically, it consists of like transcribing all of the interviews, which takes quite a while, and then kind of coding through them and looking for all of the core themes and then arranging them based on the core content. And so there were some really great online resources that were really helpful as we were kind of figuring out how to do it and learning about it on the fly. But I think overall, I actually found it more enjoyable than doing like numerical data analysis.
I think that we probably found more richness of response and nuance than you can sometimes in a written survey here.
Mm-hmm.
I see there's a question, Paige Dorsey's asking about implementing Reach Out and Read with illiterate parents. Do you have any thoughts about that, Dr. Burden?
I think I have a lot of either kind of low literacy parents in clinic or parents who don't speak English. And so for parents who don't speak English, I just encourage them to read aloud to the kids in whatever language they are fluent in. Even if even if the books are in English, it doesn't matter. They can make up a story about the book. And the same thing for illiterate parents, honestly. If they have a book with pictures, they can make up their own story with their own words. It doesn't matter if it's the same words as is in the book, especially for younger kids. Especially for these kids who are like, birth to 3 or to 5, just the act of hearing the mom's voice or hearing the dad's voice and hearing those words really helps with language development, and pointing out things in the pictures and kind of getting the kids involved is really what I would recommend.
Great, thank you. And I'll add that, of course, do refer parents to adult or family literacy resources for themselves if they're motivated to do so. Yeah. And then David Weisner is a well-known picture book author whose books have absolutely no words. So it actually takes away the stigma of parents not being able to read because there's no words on the page, yet there's some beautiful, rich stories there.
The public libraries also are really great resources for families. I know here the libraries are still closed, unfortunately, so it's been a little bit harder during COVID, but that's definitely often the first place we would send parents.
Well, thank you, Dr. Burton and Dr. Navsaria, for sharing a little more about this research that you did, and it all sounds very exciting and promising, and hearing about all the benefits of Reach Out and Read in our clinics. So with that, if anyone has any additional questions for Dr. Burton or Dr. Navsaria on this topic, feel free. I'll be sending out a feedback survey following the webinar. Just shoot me an email back with any questions you have, and we'll try to get those answered. Thank you everyone for joining us today. Thank you again to Dr. Burton for joining us and sharing, and I hope you all have a great day.
Yeah, thank you so much for having me. If anyone has any other questions, we're happy to answer questions later.
Thank you, everyone.